because it's between the two fingers been kept, and then we're going absolutely perpendicular. Maybe slightly cowed out kind of angulation, but it's absolutely perpendicular to the skin um, to look at the response. So I've got a nice video. I didn't somehow I couldn't find this video which we did. So I actually asked Dr. Dhruva Jyoti Bhaumik to actually pass me on a video which he had posted on 15th of July on the group. So it's an excellent video because it's exactly the way I would actually do my interscaling blog, and so actually have a look at it, and I'm sure you would appreciate that the patient is actually in a position. So he's marked the posterior border of sternocleidomastoid mastoid. You can see that he's going just behind the anterior scaling, put some local anesthetic in. Those 2.5 centimeter needles are not easily available, so he's using a bigger needle. And you can see why I was saying that you need to actually have smaller needle. Uh, I think even for us, we don't have those kind of saw. Now we have 4 centimeter needles. They are still longer, but it's fine. And it's so superficial. As soon as he goes in, he gets a response. They have got ultrasound, but they were doing it just to show how local anesthetic can be deposited in the right place with the peripheral nerve stimulation. Okay, they are going to get different responses. So you can see that the needle is at the same place. They get a nice deltoid response. They get biceps response. They get the radials. There you go. This is a beautiful deltoid twitch. Um, okay. But you see the needle is moving away anteriorly. So the response disappears completely. So sometimes because of the fascia need to catch the needle. And once it catches the needle, you can let go and it will likely remains. There you go. Okay. It's the weight of the, I think, the extension tubing, which makes it difficult for that. Okay, but you can see the deltoid response. You can see the biceps response. So coming to the microanatomy, why are you getting two of these different responses? And is bicep response okay if you keep getting bicep response, or do you need to actually see the delta response all the time? And the microanatomy actually explains this. This is actually not the interscaling area, but this is just for demonstration purposes. So if you look at the various cords, so you can look at that there are various fascicles, okay, within the nerve or the. For example, if this was a upper trunk or this was components upper trunk of one of the nerves, you will see different fascicles within the nerves. And so what are these? So if we look at it diagrammatically, you will understand why these are important. So, and these are various nerve roots which forms the brachial plexus. And what we're interested today is in C5, C6. And so that's the ventral. So we always come from the ventral side, or sorry, it's the dorsal side. And that's cranial, there's caudal, obviously. And here you can see that the in C5, C6, on the dorsal aspect is the axillary component and the posterior cord component, again, axillary component, the radial nerve component, okay. So, and lower, the suprascapular component tends to lie more anteriorly on C5 and there. Then you go the lateral pectoral. Okay, so you could be stimulating the radial nerve components and get biceps, axillary component, and then you get the shoulder. Okay, so it depends on which part or the component of the root you are stimulating or your needle is next to.